Hi, I'm Christy Reimer with DVM 360. I'm here with Dr. David Lane at the CVC in Kansas City. Dr. Lane is a regular contributor to DVM 360 magazine. And Dr. Lane, I just wondered if you could talk a little bit about this thing you call the poison pill. What is it, and what is a better, rather than swallowing the poison pill, what should veterinarians do instead?
A lot of discussion about local shelters, rescue organizations, no-kill, and there's a lot of opposition in the profession to that. And even down in Alabama, you can read what's going on down there. And the poison pill is actually direct opposition to the humane movement. Anything that we do against the humane movement would be perceived as we're capitalists and that we're insensitive. And this is the poison pill. Once you go directly against, you actually have no one on your side. There's absolutely nobody in the community that will take your side once you make these kind of statements, because they will view them as money-oriented. And you might as well take that pill and go home and die, because that's what's going to happen with all of this. Now, it makes us all feel good. It would make anyone feel good. I gotta oppose all this because they're tax supported and we're not, and there's no reason for them to be doing regular veterinary care when we're the best to do that in the private sector. And so you try to oppose that. That's not a good idea.
So what's a better thing to do instead?
Well, we need to build bridges. Provide kind of a network situation to resources that you have within the practice or your staff and the clients that are already in the shelter movement or in the humane movement, and you know who they are. Gather them together, try to form some sort of network to talk to the community in one way or the other. Going and just directly to the shelter, sometimes they view us with suspicion. So you have to kind of get on a neutral ground. One thing I did in my practice was to have a rescue fair where we brought my staff and the people in my practice that were in the rescue movement. They brought in other people from the rescue movement, and they all got to talk, besides make their presentations to the public. And this is one really good way, and we had a much better relationship with the no-kill community and the humane movement in that context. That's the one thing you can do, is to try to coexist.
Right. That's excellent input. Thank you very much, Dr. Lane.